portions, then I'll be opposed to it.
Congressman Ross, you originally opposed the bill in committee, then you later decided to vote for it. What was it that persuaded you to change that vote?
Well, it was 10 days of very intense negotiations. I got to tell you that, ironically, we knew this would happen all along, but once I wasn't trying to kill health care reform. If I was, I wouldn't have been in negotiations for 10 days. But we knew that once we reached an agreement, the extreme right would say a cave, and the extreme left would protest. And that's exactly what happened. I'm in the middle, and I've got the extremes of both sides mad at me, and that's okay, because I'm in the middle, and I believe that's where the majority of the American people are. I can tell you that we held the bill hostage in committee for 10 days to make it better. And if we had caved, I don't think the liberals would have then spent the next day holding it hostage in committee. But we protected small businesses. 86% of businesses in America today will no longer be subject to any type of employer mandate to provide health insurance coverage. But at the same time, those small business owners, as well as their employees, will have access to affordable health care. And we ensured that if there is a government option, it will be just that, an option. It will not be mandated on anybody. If it had been based on Medicare rates, I can assure you that it would have eventually ended up resulting in a single-payer type system, because Medicare has really good rates because they're negotiating for every senior in America. Private insurance companies could not have competed with that, and so we would have, at the end of the day, ended up with single-payer. Now we've leveled the playing field. If there is a government option, they'll have to go out and negotiate with providers just like private insurance companies do. That was important to me, to ensure that we don't end up with some type of single-payer system.
Speaking with that public option, in a letter written by the Blue Dogs to Speaker Pelosi, discussion some openness to the public plan. Do the provisions passed in the Energy and Commerce Committee reflect the same points made in that letter?
Absolutely. I mean, there now must be a level playing field. If there is a government health care option, it will be just that, an option. It will not be mandated on anyone. So they'll have to go out and negotiate rates with providers just like private insurance companies do on a level playing field. And that, to me, was very, very important.
Congressman Ross, how would you respond to the criticism that the contributions that you've received from the medical industry and insurance companies is sort of explaining your position on this issue?
I think that when you're in the eye of the storm and you stand up to the president, you stand up to the speaker, you're gonna get attacked from both sides, the extreme right and extreme left. And I wasn't sent to Washington to play politics. I was sent there to do my job. I think one of the things I don't like about this job is we do have to raise money to get reelected. My district includes 5 television markets. My district includes almost half of Arkansas. But if you go back and look, less than 8% of the funds I've raised since I first ran for Congress have come from the healthcare industry, and less than 0.0004% come from Blue Cross. So that's just partisan rhetoric.